Now, what about bariatric surgery? Can this be a treatment option for adolescents? And the answer is indeed yes. Bariatric surgery can be effective in adolescents. I have utilized this with many of my adolescent patients. It's durable reduction in BMI with few comorbidities, very few complications. You would use this in patients that have class 2 or moderate obesity or class 3, which is severe obesity. This is used in patients with unsuccessful lifestyle intervention, and you can use this early also in adolescent patients. There is a significant improvement in the quality of life and decreased mortality. The results are always better also in adolescents than in adults, just like we saw with pharmacotherapy, medications. You want to discuss patient motivation and postoperative care and long-term lifestyle changes that are needed prior to surgery because we do continue these for the life course. Now, you might be wondering, what are the key types of surgery we might utilize in persons that undergo metabolic and bariatric surgery? And there are 2 primary surgeries that we typically entertain in those undergoing surgery. The 2 primary surgeries are a vertical sleeve gastrectomy, or what we call a VSG, or a root and Y gastric bypass, or RYGB. Now, the VSG, or the vertical sleeve gastrectomy, is by far the most common procedure, being performed over 70% of the time in most cases, and the RYGB is now the least common performed surgery. The sleeve gastrectomy, we take out approximately 70 to 80% of the stomach. The fundus region of the stomach is where ghrelin is the key hunger hormone, housed in the fundus region, but also in the hypothalamus of the brain, is housed. And that's a laparoscopic procedure usually. Usually you go in that day, maybe leave the same day or the next day. Also the root-and-Y gastric bypass, mostly being performed on a laparoscopic basis, which means that we're using either a robot or using very small incision holes to do a little bit of routing. I think that's the kind of way we think about it, to reroute part of your small intestine to your stomach. Now, those surgeries are the most commonly performed surgeries. There are other surgeries that are performed that I won't go into because those make up greater than 90% of all the cases performed. Now, some adolescents are apprehensive to go through surgery because of lack of knowledge, or they feel like surgery is too drastic, or there's a lack of support. I'm here to tell you that we have significant knowledge about performing surgery. I've sent patients to surgery for quite some time now. A lot of my surgery patients are now adult patients, even helping to provide care, working with me in my center, and they have done tremendously well. The key thing is just recognizing that we need long-term support over the life course, and those multivitamins and things that you needed to take, which include a multivitamin, calcium citrate plus vitamin D alone, vitamin B12, you need to take that for the rest of your life, okay? You don't just start and take it for the first few months after surgery. You continue that for indefinitely. But I want to also recognize that once you go to surgery, you will get to a nadir point, and that will be the honeymoon period. The body will want to start regaining weight, and sometimes and oftentimes we will introduce a medication at that point to either continue weight loss or to keep you from regaining weight. That's important to work with a healthcare provider or practitioner that understands that point so that we can continue that weight loss journey for the chronic disease that is obesity. So as we go through and we're thinking about the comprehensive care of patients, particularly our adolescent patients with obesity, we have to recognize that there is a variety of treatments that we can use that range from lifestyle to pharmacotherapy to metabolic and bariatric surgery. It's about finding the right tool for the right patient at the right time, and that can vary over time. But it's important to recognize that we should support our patients with the right treatment tools without judgment, using person-first language, eliminating stigmatizing words like obese, and making sure we eliminate other terms like morbid. We can do this with a family-centric, patient-centered, focused-in approach. We can do this together. Thank you so much. It has been a delight being here with you today.